Good morning, everyone. We're going to get started at 11. We're going to just give folks another couple minutes. Good morning, everyone. I am Jenny Noonan, and we are going to go ahead and get started. Welcome. We are providing Spanish interpretation for today's hearing. To listen to the hearing in either English or Spanish, everyone will need to select a language at the bottom of your screen. Click on the globe and then select either English or Spanish. I'm Jenny Noonan, and I am the Director of EPA's Office of Air Quality Planning and Standards Policy Analysis and Communications Group. And I will be chairing the session for this virtual public hearing. Thank you all for taking the time out of your day to share your comments on EPA's proposal to reduce ethylene oxide emissions from commercial sterilization facilities. This proposal, which was announced on April 11th, 2023, would significantly strengthen and update Clean Air Act standards for ethylene oxide, also referred to as ETO, emitted into the air from commercial sterilizing facilities, also called commercial sterilizers. The proposed rule is estimated to cut emissions of ETO from these facilities by 80% when the rule is fully implemented. Now I'd like to ask our other EPA panelists to introduce themselves. On the panel we have, Brian, you want to start?
Sure. I am Brian Schrager, and I am the coordinator of our Clean Air Act Section 112 regulatory program. It's good to see everyone.
Hi, and I'm Margaret Seifert. I'm from Region 5, US EPA, and I've worked on the ethylene oxide sterilization work group.
Great. Thank you. Thank you both. We are also joined today by a transcriptionist who will produce a written transcript of today's hearing. We will add the transcript to the public docket for this rulemaking and will carefully consider your comments as we develop a final rule. We're going to go through some ground rules. Before we begin the hearing, I have a few ground rules and housekeeping items to review to help make today's hearing run smoothly. First, EPA is committed to an environment of mutual respect and safety. We want to hear your views on the proposed rule today. However, the agency will not tolerate harassment, discrimination, intimidation, inappropriate language or images, or sustained disruption of the public hearing. EPA expects everyone participating in this hearing, including registered speakers, attendees, and those of us on the panel, to conduct themselves in a respectful and civil manner. We will monitor and moderate this virtual event to ensure that common standards of decency are upheld. Please note that by registering for this event and attending it, you are agreeing to abide by the ground rules of the virtual hearing. Okay, how will the hearing work? All right, we're going to move on to how today's hearing will work. If you are registered to speak, you should have received an email notification that included an approximate time window for when you will be invited to speak. We will do our best to stick to that as close to that time as possible. If you have joined us through Zoom, please keep the chat box open. It is at the bottom of your screen. We will put the names of the next speakers in the chat box. We may also use the chat to communicate directly with you during the hearing. I will call on each speaker when it is their turn. And let me apologize in advance for any mispronunciations. Please correct me. When I call on you to speak, please unmute your line. If you are joining us via Zoom, that button is on the lower left of your screen. If you're joining us by phone, you can mute and unmute yourself by pressing *6. When you start, please state your first and last name and then spell it for the record. When you are providing testimony, you are welcome to activate your video camera by clicking on the Start Video icon at the bottom left of your screen. If you are not testifying, please keep your camera off. Each speaker will have 4 minutes to give comments. A 4-minute timer will be displayed on the screen to help you keep track of your time. The timer will start when you state your name. When your 4 minutes are up, it's time to stop. If you are testifying by phone, the timekeeper will alert you when you have 1 minute remaining. To be fair to everyone, we are going to strictly enforce the 4-minute limit. If you have additional items that you would like to share, such as slide presentations or videos, you may submit them to the docket for the proposal through June 12, 2023. We encourage you to submit a written copy of your testimony, any testimony that you provide today. We will post information about how to submit comments in the chat box throughout the hearing. We are here to listen to you today. However, panel members may ask a question to clarify your comments. When you are finished speaking, please remain on the line until I am able to confirm that there are no further clarifying questions from our panel. Once we are done, please remute your line and turn off your camera. I will then call on the next speaker, and so on. If time allows, we may be able to add additional speakers. If you did not pre-register and are interested in speaking today, please send a direct message to attendee support in the chat box. Our logistics team will let you know if there are any time slots available and assist you with registering. You may also email us, and the email address is, there is an email address that I think we will be putting in the chat as well. Finally, today's hearing consists of 3 sessions: morning, which we're doing now, afternoon, and evening. If there are no additional speakers, we may close the session 15 minutes after the last registered speaker has testified. We may also take short breaks as needed. Thank you again for taking the time today to share your comments on EPA's proposal. Let's get started. And I'm looking at the chat box, and our first two speakers today are Sarah Busick and Ursula Tenue. So Sarah, if you want to turn on your camera and unmute yourself, we will be happy to take your testimony. It's good to see you.
Good morning. My name is Sarah Bucic, and I'm with the Alliance of Nurses for Healthy Environments. We're the only national nursing organization focused solely on the intersection of health and the environment, and we appreciate the opportunity to provide comments on this proposal. One of our roles as nurses is to create healthy environments in which individuals, families, groups, and communities can not just survive but thrive. And we're here today to request the swift adoption of these standards to strengthen the Clean Air Act standards for ethylene oxide, which are emitted into the air from commercial sterilization facilities. We applaud EPA's proposed rule. EPA reports that the Clean Air Act lists ETO as a hazardous air pollutant or an air toxic. And despite its wide usage, EPA, National Toxicology Program, the International Association of Research on Cancer, they all classify ETO as a carcinogen. And therefore, the very product that is used to sterilize critical medical equipment also poses a danger to people who live, work, or attend school near these facilities. And chronic exposure through inhaling ethylene oxide can cause cancers of white blood cells, non-Hodgkin's lymphoma, as well as breast cancer in women. And children are particularly vulnerable, with their bodies experiencing frequent cell divisions as they grow, and they're susceptible to DNA mutations caused by ethylene oxide exposure. Acute inhalation of ETO can also contribute to respiratory issues, headaches, nausea, vomiting, and fatigue. And according to the FDA, approximately 50% of sterile medical devices in the US are sterilized with ETO, which is about 20 billion devices a year. While this forthcoming rule pertains to commercial sterilizers, according to the Union of Concerned Scientists report, commercial sterilizers are just one of several types of facilities that emit ETO. There's actually 12 communities in the US that are sterilizer hotspots, meaning they're exposed to ETO from more than one sterilizer. And EPA's decision to consider requiring facilities to reduce ETO emissions comes after decades of communities and workers shouldering the burden of harmful exposures. Community members and workers should not have to carry the burden of ensuring that facilities control these cancer-causing air emissions. EPA's Integrated Risk Information System conducts risk assessments to identify and characterize the health hazards of chemicals, but it's been 7 years since EPA's IRIS program updated its risk assessment for ETO inhalation, determining that the chemical is a carcinogen. And in 2022, after assessing risks to communities near active commercial sterilizers, EPA found an elevated cancer risk in 23 of these communities related to ethylene oxide. The concept of acceptable risk has to be questioned when people's lives are at stake. Acceptable risk must also be questioned when more than 14 million people live within 5 miles of the 104 ethylene oxide emitting facilities in the US, and when these are people of color, people with low incomes, or people with limited English proficiency. There's also more than 10,000 schools and childcare centers in the vicinity of these commercial sterilization facilities. And these assessments don't always consider cumulative impacts, such as poverty, which can increase susceptibility to poor health outcomes. In light of the above information, we're asking that EPA strengthen the ETO emissions controls at commercial sterilizers and require controls for fugitive emissions. We ask that EPA ensure that new risk reviews include a margin of safety to protect public health and improve enforcement, monitoring, and accountability of emissions, and communicate these risks to communities. And we ask that you reach out to communities and consider these cumulative impacts. We urge EPA to strengthen and adopt these proposed standards to protect the health and safety of patients, communities, and workers. Thank you.
Thank you so much for your testimony. And if you had any studies that associated with that, we would be happy to have you, if you could submit them for the record, and information about how to submit is in the chat. Any questions from the panel?
No, we don't have any questions, and appreciate your testimony.
Thank you. In addition, I just want to remind folks that we are having this translated into Spanish. And if you could speak slowly to make sure that the translator is able to get everything that you are saying as they are working as well. So up next, we have Ursula. I'd like to turn on your camera. Great, thank you for joining us.
Hi, thank you for having me. My name again is Ursula Tanaway, Urzula, Tanaway, Tanouye. I want to start today by saying thank you to all of you on the listening panel for being here. This process can be really draining, and I appreciate that you're here and that you're taking public comment seriously. Regarding the sterilizer rule proposal, I appreciate that EPA is taking some significant steps forward in the proposed rule, including the requirement that all sterilizers obtain a Title V permit, the inclusion of continuous stack monitoring, the new attention to fugitive emissions, and worker safety provisions to address the staggering 1 in 10 cancer risk that these employees face. One glaring omission from the rules is a genuine attempt at regulating fugitive emissions. For years, communities have been unified in demanding ambient air monitoring. We deserve to know how much industry poison we breathe. No amount of industry-provided calculations or parametric monitoring of engineered solutions can substitute the need for physical measurements of ETO levels in our community air. No scientist worth their degree would ever claim that engineering controls, calculations, or even the best models, that these can substitute for physical measurements. At the levels we expect to see, ambient air monitoring gives us the most complete answer to the big picture questions we all care about. Are the rules being followed? And are the rules enough? We know from the issuance of the HAN proposal that the EPA has a trusted method for ambient air monitoring of ETO. Clearly, the measurement method is not an issue for EPA. If the issue is the placement of canisters in appropriate and secure locations, I urge EPA to make good on your claim that you value your partnerships with state and local governments. Many individuals from communities around the US spoke up yesterday emphasizing the need for ambient air monitoring. We are ready to be your partners and help you figure out the logistical details with our local governance tools. But first, we need EPA to set the ambient air monitoring standard in the sterilizer rule, just like you did for HAN communities. Our motivation is simply to know the truth, because ultimately, we fence-line communities are the ones who deal with the fallout of the world as it is, not the promises of calculations and designs. I would also like to point out that excluding off-site aeration warehouses is simply inviting sterilizers to use these off-site aeration sites to decrease their pollution control costs and bypass regulations. It's as predictable as Twitter's blue check fiasco. Those aeration sites are extensions of the sterilization process, whether the land they're on is contiguous with the start of the process or not. Their contribution of ETO to our community air needs to be controlled, quantified, and reported, including with ambient air monitoring. And finally, the sterilization industry has known this regulation update was coming for decades. Some disclosed it to potential investors in the 1990s and started fighting accountability and reform in 2006 when they successfully delayed the release of the IRIS evaluation for a decade. The longer implementation timeline simply provides a longer accumulation of harm. We're asking for a much shorter timeline than 18 months. They've already known and delayed for decades. Thank you for your time and attention today. Jenny, you're still on.
Sorry. Thank you. Thank you so much for your testimony. And any questions from the panel?
No, we don't have any questions. And thank you for your testimony.
Thank you. And my lights have gone off, so I apologize. Okay, thank you. All right, up next, we have Christopher Clausen, and then on deck, we'll have Beth Priadatis. Chris, thank you for joining us. If you could remember to just speak slowly so that we can make sure that Spanish translator has the ability to translate appropriately.
Hi, thank you. Can you hear me okay?
We can.
Great. Okay. Thank you. My name is Chris Clausen, CHRISKLOSEN, president of the Ethylene Oxide Sterilization Association, or EOSA, a nonprofit organization whose members include medical device sterilizers and spice processors. Our members have a common interest in supporting the safe use of ethylene oxide for medical device sterilization and spice fumigation. EOSA has many concerns with the draft sterilizer NESHAP and PID due to the significant adverse effects they will have on the availability of sterilized devices for needed medical procedures that are essential to the American public, as well as our concerns for the supply of safe and wholesome spices. First, we would like to emphasize the critical supply chain roles that ETO fills. For a large number of medical device types, ETO is the only available sterilization option due to materials of construction compatibility and its ability to sterilize at low temperatures, among other factors. It is the necessary modality for over 50% of sterilized devices and is used to sterilize more than 20 billion devices per year. A common misconception is that ETO is widely used for cost reasons. In fact, ETO is generally not the cheapest method, but rather the only method for sterilizing very many devices. For spices, ETO provides a critically needed way of reducing microbial load to make spices safe to consume without affecting their quality. We also express our deep concerns with the 2016 ETO IRIS assessment, which unfortunately has been used as the basis for the draft rules. This assessment is deeply flawed and has caused public alarm by erroneously concluding that ETO is carcinogenic at levels at or well below background air concentrations across the country, including rural areas far from any industrial emissions source. After disregarding a significant amount of peer-reviewed science, including an assessment from the Texas Commission on Environmental Quality, TCEQ, that shows EPA's conclusion is not correct, EPA has nonetheless moved forward with its deeply flawed conclusion that ETO is dangerous at levels so low that the ETO emitted from ubiquitous natural sources, such as plant decay and generated within the human body, are hazardous to health. EPA relied on only a narrow subset of the available data, conducted a flawed analysis, and dismissed other data that contradicted its evaluation. The EPA's 1 in 10 cancer risk claim regarding sterilizer workers, for example, is unrealistic in the face of numerous peer-reviewed studies, including an epidemiological study that showed no risk at far higher exposures than currently allowed. The draft NESHAP and PID requirements based on this flawed assessment are also deeply concerning. As drafted, they would cause significant loss of medical device and spice processing capacity, which is already straining to meet the needs of our country's healthcare system. A significant number of the new requirements are simply not possible for many facilities to implement. For example, automating plants not designed for this, which would basically require complete building tear down and rebuild, crippling the ability of the industry to provide essential sterilized medical devices to patients across the country. Many of the requirements come with unreasonable timelines because the technology and equipment are not currently available, especially in the context of procurement by an entire industry of sterilization facilities, or because they mandate revalidation of a huge number of sterilization cycles that would take many years, even decades, to complete. In all cases, these regulatory actions have the potential to cause a national healthcare crisis, as well as a shortage of safe spices for no appreciable health benefit to the public or to workers, as they are based on the highly flawed ETO IRIS assessment. Thank you for the opportunity to speak today.
Thank you for your testimony. Any questions from the panel?
No, we don't have any questions and appreciate your testimony.
Thank you.
Thank you. Up next, we have Beth Kryadatis.
That's right, Beth Kryadatis.
Thank you. Yes, we can hear you. And if you could speak slowly and spell your name. Thank you.
Thanks. Yes, my name's Beth Kryadatis. It's Kreydatus. Thank you so much for your time today. I'm an educator and a Henricos County resident. I live between 2 sterilization facilities in the Richmond area, one of the 12 sterilizer hotspots. As an educator, I take the responsibility of teaching young people about their environment, science, and health very seriously. This year, I've had the privilege of working with 2 classes of 9th graders attending Verina High School in Eastern Henrico County, a school that's just a little over 3 miles from Sterilization Services of Virginia, a facility that is emitting somewhere between 8,000 and 5,000 pounds of ETO annually. It's an area that the EPA has identified as posing an elevated cancer risk. The students at Verina, a school that serves a predominantly African-American student body, are in a specialty center studying environment and sustainability. They also mentor elementary students at a nearby elementary school, Montrose Elementary. This is almost entirely a Black, Indigenous, people of color school. It's a building that's just 2 miles from this facility. When I met with the students at Verina, they're mostly 14-year-olds, I felt ethically conflicted about the appropriateness of telling these young people about the cancer risks that the EPA has acknowledged that the sterilization services poses to them. Some of these young people live less than a mile from this facility. It feels ethically wrong, or at least morally fraught, to tell young people that they have grown up breathing toxin levels that the EPA now acknowledges puts them at an elevated risk for cancer. I don't want to scare a bunch of 14-year-olds, especially given that these children have grown up with the trauma of a pandemic. But I feel the greater moral weight is upon this panel and us as a community, bearing the responsibility for making the decision whether to implement much greater safety measures for these young people. When I told these 14-year-olds about the facility and the science that shows the risks posed by ETO, they were scared, especially for their families. They wondered about whether ETO was responsible for health issues in their own families. And one of the young people who lives about a mile from the facility reported that he had had headaches for most of his youth, and he was worried that those were connected to the facility. But they also reflected on ways that they could push for change. I'm proud to report that these 14-year-olds drafted a petition. They've just started this in their community, and they're asking for positive change. And so I'm going to quote from their petition here. They say, quote, "These centers are built in areas that are predominantly Black and have low income. This is an environmental injustice being placed upon the citizens of Henrico without them even knowing about it. We are being exposed to a substance that affects our body, our reproductive system, and more without knowing it. However, now we know and we can do something about it. If possible, I would kindly ask you to please sign our petition to stop this injustice and let us breathe nice, clean air." I ask that this panel advocate for the strongest regulation of ETO possible. In addition to the proposed regulations, which I applaud, I'd like to see required fence line monitoring of ETO and a rapid response to phase ETO out for safer alternatives. Thank you so much for your time.
Thank you for your testimony. Any questions from the panel? I would encourage you to submit the petition if it's completed by the June 12th deadline. Thank you.
No, we don't have any questions, and appreciate your testimony. So, well, missed my mute button there.
Thank you. Up next, we have Dean. I'm sorry. Up next, we have Dean Paranikis.
Dean Paranaki.
Thank you. Thank you. If you would like to turn.
I can't get my. Hello?
Hello?
Yes, I've got my video, but I can't. I seem to be muted.
I can hear you, but I can't see you.
Oh, let's see. Wait, there we go. Okay, sorry about that. Dean Paranicas, DEAN PARANICAS. I am the president and chief executive officer of the Healthcare Institute of New Jersey, commonly known as HINGE, the trade association for our state's research-based biopharmaceutical and medical technology companies. New Jersey is called the medicine chest of the world for a concentration of life sciences companies that are global leaders in advancing human health. Our medical device, technology, and diagnostics companies improve patient outcomes and contribute significantly to New Jersey's workforce and economy. With 12 of the world's top 20 medical technology companies having a presence in 40 facilities across the state, along with hundreds of emerging companies, they support over 12,000 jobs and generate $5.6 billion in annual economic impact. FDA and the EPA agree that ethylene oxide is a critical and proven sterilization method, as reflected by the fact that it is used to process approximately 50% of all medical devices, or 20 billion products in the United States each year, while representing only 0.5% of all commercial ETO use. With 1 billion doctors' visits and over 33 million hospitalizations each year, this amounts to billions of pieces of sterile medical equipment that are needed. Over the past 80 years, ETO has become one of the most common ways to sterilize medical devices, and for many of them, it is the only viable one. Many products otherwise would be rendered unusable by other sterilization methods. As noted by FDA, until the best alternative can be identified on which our industry is continually working, quote, other methods of sterilization cannot currently replace the use of ETO for many devices, unquote. With ETO sterilization at capacity nationally, any long shutdowns or permanent closures would significantly disrupt access to sterile medical devices, which would be disastrous to patient safety and overall public health in the United States. With respect to the NESHAP and FIFAP proposals, our industry has long supported workable rules regarding ETO sterilization that protect our employees, the communities where we operate, and public health, while ensuring the continued availability of sterilized medical devices. Sterilization facilities undertake exhaustive efforts to ensure public safety by capturing and destroying more emissions than required. They strive to eliminate any contribution, however minuscule, to the perception that carefully controlled medical device sterilization is anything but safe for employees, neighbors, and communities. Many of these facilities are working with FDA on using less ETO where possible and on alternative methods where appropriate, without compromising America's healthcare system. We share the concern that the EPA's proposed NESHAP regulation and its FIFRA proposal are being advanced on an expedited implementation timeframe and very short comment period to cover over 1,000 pages of rules. This can put patients at risk if we do not allow sufficient time to seek input from subject matter experts such as toxicologists, healthcare providers, medical technology companies, and sterilizers, as well as patients, to explore technology-neutral solutions to meet new emissions targets. In summary, the medtech industry remains committed to a safe sterilization process that continues to protect our employees, the public, and communities at large, as well as millions of patients who depend on a safe and uninterrupted supply of sterilized medical supplies, and our industry looks forward to working with the EPA to achieve this. Thank you.
Thank you for your testimony. Any questions from the panel?
No, I have no questions. Thank you for your testimony.
Thank you.
Up next, I see you've popped on. Welcome. Can we?
Yes, hello.
Yes, go ahead, get started.
Yes, hello, my name is Dave Arndt, Davearndt. I'm a resident of Baltimore, Maryland, an environmental and social justice advocate, a chemical engineer, and a retiree of the National Institutes of Health. Thank you for hearing my testimony today on the new rules for ETO. There are a few fundamental chemicals that are building blocks to most things that we use. One of them is ethylene oxide. It is also used by the commercial sterilization companies to render germ and pest-free items. ETO is also a highly volatile chemical and a known carcinogen. Facilities sterilizing food or medical products emit ETO from chimneys and vents, but it also leaks from pumps, valves, pressurized connectors, a phenomenon we call fugitive emissions. Current EPA regulations for public health don't require facilities to account for fugitive emissions. Also, regulations don't cover warehouses or what we like to call off-gassing centers. These can emit far more ETO gases than sterilization plants themselves. Scientists have documented the associated health risk of ETO since the late 1970s, and in the last 5 years, there have been more than 2,600 studies on the negative effects of ETO. Please see PubMed for details. Maryland has 4 commercial sterilizers. More than 343,000 people live within 5 miles of at least one of these facilities. 3 of the 4 of these sites have communities around them that have a proportional higher concentration of people of color than the rest of the country or county they live in. There are 2 sterilizers between Washington and Baltimore. The EPA has identified both facilities as contributing to elevated cancer risks. Do these residents know about the ETO health risks? In a word, no. These facilities look like a warehouse with no big smokestacks or other chemical complex indicators. There are townhomes almost directly across the street. There are running paths and bike trails nearby. There is an EPA site that lists these facilities as 2 of the top 23 emitters. However, there has been no communication of that fact to the residents nearby. There are supposed to be town halls for which I have signed up. However, for the last 6 months, there hasn't been any information or notification when or if they're going to be held. The other issue with these plants is they are sterilizing food. ETO just doesn't magically disappear. Residues of this cancer-causing substance remain. Unfortunately, processors don't have to tell consumers about this. Europe has banned ETO food sterilizers and prohibits the importation of ETO sterilized food. Since 2003, Australia has banned the use of ETO for foods that are sold in Australia. To protect the health and residents of the United States, we should end sterilization of food immediately. There are alternatives that are readily available. In fact, McCormick Spice, one of the nation's largest spice producers, does not use ETO. We need to have continuous fence line monitoring of all sterilization facilities and off-gassing centers. The EPA should be working with the FDA to consider phasing out the use of ethylene oxide in medical device sterilization industry. Finally, these rules are long overdue, and we need to adopt these rules in the next 12 months. 18 months is way too long. People's lives and well-being are at stake. Thank you very much for having my testimony.
Thank you for your testimony. Any questions from the panel?
No questions. Thank you for your testimony.
And up next, we have Ashley Halton. I thank you for turning your camera on. If you could remember to speak slowly for the interpreter, that would be wonderful. Go ahead when you're ready.
Excellent. Thank you. Good morning. My name is Ashley Haltom, and I'm here today speaking on behalf of the Center for Global Health Innovation and Georgia Bio, the 30-year medical technology trade association here in Georgia. The medtech industry represents almost 7,000 jobs in Georgia and a $1.9 billion economic impact. More so, Georgia is home to almost 11 million citizens, roughly 85% of whom have yearly healthcare visits with their physician, requiring properly sterilized medical devices. The sterilization of medical devices is a critical aspect of modern healthcare and is essential to prevent infections and ensure patient safety. Ethylene oxide is one of the most effective and common sterilization methods used to sterilize 20 billion or 50% of all medical devices in the United States each year. In fact, ETO is the only sterilization method to meet FDA requirements for many devices. Ethylene oxide is highly effective in killing microorganisms and spores. It can penetrate packaging and other materials, ensuring that all surfaces of the device are thoroughly sterilized. This is particularly important for complex medical devices with small, hard-to-reach areas. Its ability to eliminate bacteria, viruses, and fungi significantly reducing the risk of infection in patients. Additionally, ETO sterilization is compatible with many different types of medical devices. It can be used to sterilize a wide range of materials, including plastics, metals, and electronics. This makes it an ideal method for sterilizing medical equipment and supplies that are often made of a variety of materials. It also leaves no residue, meaning there is no need to rinse or dry the device after sterilization, which saves time and resources. ETO exists all around us, even in areas where there are no known emitters of ETO to be found, making it difficult to pinpoint the exact source. 2 years ago, the US EPA initiated a study to determine whether ETO was more broadly found in ambient air than previously understood. Air monitoring readings were taken by the EPA at 18 sites across 9 states, with broad-ranging populations and climates in rural and urban areas. Results showed higher levels of ETO than expected, even in rural areas where there was no manufacturing of any kind. Additionally, the Georgia Environmental Protection Division, which regularly performs air monitoring, also found that average levels of ETO in the ambient air in Metro Atlanta are consistent with what EPA found nationwide. Even in areas of Georgia where there are no sterilizers or industrial users of ethylene oxide, levels of ETO were found to be higher on average than in Covington, where a large commercial sterilization facility operates. We also asked the EPA consider that medical device sterilization is only 0.5% of all commercial ETO use, but represents an enormous impact on healthcare accessibility and patient outcomes. Currently, ETO sterilization is at capacity, meaning long shutdowns or permanent closures would significantly disrupt patient access to sterile medical devices and prove disastrous to patient safety, the daily practice of medicine, and overall public health in the United States. The goal of the industry has always been and continues to be the safe delivery of medical care, and we welcome the opportunity to work with the EPA to address their concerns while continuing to provide safe and effective sanitation of life-saving medical devices.
Thank you for your testimony. Any questions from the panel?
No questions, but thank you for your testimony.
Thank you.
This time, we have an opportunity for anyone who has not registered to speak to go ahead and raise your hand or send a note to attendee support. If you would like to testify, if you are scheduled for a slot later in the day or tomorrow or this evening, or you were thinking of going tomorrow, now we have some time and we would be happy to take you now. I'm just going to scroll through the list and see if anyone raises their hand. And also looking in the chat in case anyone Okay, I don't see anyone. What we're going to do is we're going to take a 15-minute break, and we'll return in 15 minutes and resume the session at that point. Thank you, everyone. Welcome back, everyone. My name is Jenny Noonan, and I have been chairing this hearing session. I want to thank everyone who has shared comments so far on EPA's proposed action. I am having technical difficulties. Can anyone hear me?
Yes, we can hear you, Jenny.
Okay, I'm going to continue on. I have a completely gray screen. So I'm going to ask Brian to be ready to call the next speaker, and I'm going to reboot after reading this statement. My name is Jenny Noonan, and I've been chairing this hearing session. I want to thank everyone who has shared comments so far on EPA's proposed action. If you have questions about today's hearing or are interested in registering to speak, please send a direct message to attendee support in the chat box. If you are joining us by phone, you can raise your hand by pressing *9, and our logistics team will reach out to you and let you know if there are any time slots available. So with that, I'm going to turn off my computer, and Brian, I hope that you and Margaret can proceed without me. I'll return as soon as I can. Thank you.
Okay. Thank you, Jenny. And I'd like to invite our next speaker, Sheila Cerna, to please turn on your camera and microphone and provide your testimony. Thank you.
Hi, good morning. My name is Sheila Cerna. I am the Climate Science and Policy Director at the Rio Grande International Study Center and a member of the Clean Air Laredo Coalition. I've spent the past year bringing awareness to my community in Laredo, Texas, about the dangers of living near Midwest Sterilization, which is a local commercial sterilizer that uses the most ethylene oxide in the nation, roughly 600 tons per year, equivalent to 1.3 million pounds a year to sterilize medical equipment. And Midwest Sterilization proudly advertises that they work round the clock, 24 hours, 7 days a week, making our exposure for the past 17 years even more significant. During this time, we've learned that the Texas Department of State Health conducted 2 cancer studies for the census tracts nearest to Midwest Sterilization. The first study found a statistically significant rate of non-Hodgkin's lymphoma. The second study found a statistically significant rate of breast cancer and leukemia. As you all are aware, those cancers, breast, leukemia, and non-Hodgkin's lymphoma, are the 3 types of cancers that are associated with long-term ETO exposure. In a case study conducted by the Union of Concerned Scientists, it was discovered that commercial sterilizers primarily affect Latino and Spanish-speaking populations. Laredo is one of those communities where 95% of the people that live near Midwest are Latino, 30% are low income, and 11% have limited English language proficiency. There are also 52 schools and childcare centers within 5 miles of Midwest Sterilization. So the time for action is now. We can no longer allow facilities like Midwest that handle large amounts of this extremely dangerous chemical to go under-regulated. We're asking that the EPA require ETO commercial sterilizers to conduct their own third-party fence line air monitoring and include that in the rule. EPA must require for these facilities to also disclose the locations of their offsite warehouses, which are nothing more than aeration rooms, and require those to have their own emission control systems as well. And, the EPA must maintain that these facilities that use ETO to sterilize obtain a Title V permit, regardless of industry pushback. We understand the importance and need of sterilized medical equipment, and our fight has never been about that, but it has been about the protection of our children and our community. So as a member of the coalition, the Clean Air Laredo Coalition, we ask that you do not let industry distract you from the fact that there are people who are affected by years of ethylene oxide exposure, not only in Laredo, but around. the nation. So thank you for your time and consideration.
Thank you, Sheila. Could you please take a moment to spell your name for the interpreter and for the record?
Oh, yes, I apologize. It's Sheila. Serna is Serna.
Thank you very much. Margaret, did you have any questions? Okay.
No questions for me. Thank you.
Thank you very much for your testimony.
Thank you.
At the moment, we don't have any registered speakers in the room. So if there is anyone on the call who would like to testify now, if you could please raise your hand if you have interest in providing testimony. A note for our organizers, I can't see if anyone is raising their hand, so you can let me know. Oh, and there's Jenny.
Thank you, Brian. I do not see anyone's hand up, and I don't see anything in the chat, no hands raised. So perhaps we could take another 15-minute break and return return to the testimony at that time. Thanks, everybody. Brian. Before we get started, I just want to say my computer screen is acting unusually. And so I may need to, if I go blank again, I may need to throw things back over to you. So I apologize in advance, but it's doing what it did just before everything went gray. So my apologies.
Well, we will try to keep going.
Yes, thank you.
I can hear you at least. So,
Okay.
and we can see you.
Okay. It has completely frozen. Can you still hear me?
I can still hear you and see you.
Wow, that's weird. It's like anyway. It is now 12:15 and I can still see the chat. So at this point, it looks like we do not have anyone on deck to testify. If anyone is interested in doing so, please raise your hand and or send.
Okay, we do have a hand raised, Jenny.
Okay, great. Brian, could you take it from here? I don't think I can even put myself on mute, but I'm going to sit quietly and just turn things over to you.
Okay, I saw Margie Donnell's hand raised.
Yes. Hi, good morning. Thank you for taking the time to listen to me. I'm actually scheduled to speak in about an hour and 15 minutes, but I have a conflict. But
Okay.
I wanted to jump on now if I could to give my position.
Yes, that will be fine. I'd like to ask you to please spell your name and make sure that you speak slowly so that our interpreter can keep up.
Sure. My name is Margie Donnell, Margie Donnell. And I have about 7 points I'd like to make today. The first point is that I'm asking the EPA to require there to be fence line monitoring in the rule. I'm also asking the EPA to require ambient air monitoring. I'm sure you're all aware of the situation we had in Willowbrook, Illinois, and I believe that that is a prime example of why these additions are required in the rule. We did ambient air monitoring, we did fence line monitoring. The numbers that were resulted from that were different than that from testing the equipment and testing the stacks. I think it's Exhibit A as to why they're required and why testing the stacks and equipment is just not enough. The other item that I have here is a request to ban ETO in food, in spices, and any other of the miscellaneous items that it's being used in. I saw that it was being used in sterilizing baby basins and things that just do not require that level of sterilization, or at least do not require that avenue of sterilization. I think limiting the items would significantly reduce the use, and adding all the testing would then further protect the public from the harm that can be made. The next item that I have is monitoring at any facility that stores sterilized products for aeration or off-gassing, or just stores the products after it is sterilized. It is important because, again, in Willowbrook, when they would open the garage doors, the levels of ETO would go so high at the fence line monitoring. And it was clear that testing just at the stack was just not enough. As it's off-gassing, it is being released, and the levels are very high. My next item is to implement this rule sooner than 18 months. If they need to have staggered deadlines, based on parameters such as number of sterilizers or the volume of ETO used, I think it's important. I understand the EPA tends to look at the smallest business in determining this and the cost associated with it, but I think that you need to look at the whole picture and perhaps stagger it if need to be. I would request a 90-day deadline for everybody. These businesses have the rule for rule change itself is years and years delayed. These businesses have been aware. They're aware of the monitoring. They're aware of the situation. Do not continue to put the public at risk in order to give them more time. I request the EPA put the people's health first. This is a lucrative business, and they should be required to conduct their business the safest way possible. This is the time to make sure the rule is all-encompassing and it covers all aspects necessary to protect the health of the public. That will not be accomplished without fence line monitoring, ambient air monitoring, off-gassing monitoring, and limiting the items that can use ETO. I thank you for your time.
Okay, thank you very much. And do we have any questions from the panel?
No, I don't have any questions. Thank you.
All right. Thank you very much.
Appreciate your
your
time.
testimony. Okay, once again, we do not have registered speakers at the moment. So if anyone would like to testify now, if you can please raise your hand. We'll wait a few moments here. Okay, so seeing none. Okay, at this time, there are no additional registered speakers for the session. So I'd like to thank my fellow panelists, everyone who offered testimony today, and everyone who took time out of their schedules to listen to today's hearing on EPA's proposal to reduce ethylene oxide emissions from commercial sterilization facilities. As a reminder, you can submit written comments on this proposal through June 12th, 2023. And we will now take a recess, and the next session will begin at, I believe is it 1:30 p.m.? Yes. Okay. So thank you very much, and we are concluding this session at this time.
All right, it is 1:30, so let's get started. So welcome back to the public hearing on the ethylene oxide sterilizers proposal. Welcome. I'd like to note today that we are providing Spanish interpretation for today's hearing. To listen to the hearing in either English or Spanish, everyone will need to select a language at the bottom of your screen. Click on the globe icon, then select either English or Spanish. My name is Daryl Weatherhead. I'm the group leader of the economics group in EPA's Office of Air Quality Planning and Standards, and I will be chairing this session of the virtual public hearing. Thank you for taking time out of your day to share your comments on EPA's proposal to reduce ethylene oxide emissions from commercial sterilization facilities. This proposal, which EPA announced on April 11th, 2023, would significantly strengthen and update Clean Air Act standards for ethylene oxide, also referred to as ETO, emitted into the air from commercial sterilizing facilities, also called commercial sterilizers. The proposed rule is estimated to cut emissions of ETO from these facilities by 80% when the rule is implemented. Now I'd like to ask our other EPA panelists to introduce themselves. On the panel are.
Hi, my name is Kim Wilson, and I'm a team lead in the Office of Chemical Safety and Pollution Prevention.
And my name is Patrick Lassard. I'm a group leader in the Office of Air Quality Planning and Standards.
We are also joined today by a transcriptionist who will produce a written transcript of today's hearing. We will add the transcript to the public docket for this rulemaking and will carefully consider your comments as we develop a final rule. So before we begin today's hearings, we have a few ground rules and housekeeping items to review to help make today's hearing run smoothly. First, EPA is committed to an environment of mutual respect and safety. We want to hear your views on the proposed rule today. However, the agency will not tolerate harassment, discrimination, intimidation, inappropriate language and images, or sustained disruption of the public hearing. EPA expects everyone participating in this hearing, including registered speakers, attendees, and those of us on the panel, to conduct themselves in a respectful and civil manner. We will monitor and moderate this virtual event to ensure that common standards of decency are upheld. Please note, by registering for this event, you are agreeing to abide by the ground rules of the virtual hearing. All right, so let's move on to how this hearing will work. If you registered to speak, you should have received an email notification that included an approximate time window when you will be invited to speak. We will do our best to stick as close to that time as possible. If you have joined us through Zoom, please keep the chat box open as it is at the bottom of your screen. We will put the names of the next speakers in the chat box. We also may use the chat to communicate directly with you during the hearing. I will call on each speaker when it is their turn. Let me apologize in advance for any mispronunciations. Please correct me as we go. When I call on you to speak, please unmute your line. If you are joining us via Zoom, that button is on the lower left of your screen. If you are joining us by phone, you can mute and unmute yourself by pressing *6. Please state your first and last name and spell it for the record. When you are providing testimony, you are welcome to activate your video camera by clicking on the Start Video icon at the bottom left of your screen. If you are not testifying, please keep your camera off. In addition, I will ask that you please speak slowly while providing your testimony today. This will allow our interpreters time to translate. Each speaker will have 4 minutes to give comments. A 4-minute timer will be displayed on the screen to help you keep track of your time. The timer will start when you state your name. When your 4 minutes are up, it is time to stop. If you are testifying by phone, the timekeeper will alert you when you have 1 minute remaining. To be fair to everyone, we are going to strictly enforce the 4-minute limit. If you have additional items that you would like to share, such as slide presentations or videos, you may submit them to the docket for the proposal through June 12th of 2023. We encourage you to also submit a written copy of your testimony that you provide today. We will post information on how to submit written comments in the chat box throughout the hearing. We are here to listen to you today. However, panel members may ask questions to clarify your comments. When you are finished speaking, please remain on the line until I am able to confirm that there are no further clarifying questions from our panel. Once we are done, please remute your line and turn off your camera. I will then call the next speaker, and so on. If time allows, we may be able to add additional speakers. If you did not pre-register and are interested in speaking, please send a direct message to attendee support in the chat box. Our logistics team will let you know if there are any time slots available and assist you with registering. Finally, today's hearing consists of 3 sessions, morning, afternoon, and evening. If there are no additional speakers, we may close a session 15 minutes after the last registered speaker has testified. We will also take short breaks as needed. Thank you again for taking the time today to share your comments on EPA's proposal. Now, let's get started. Our first 2 speakers this afternoon will be Marvin Brown IV and Michael Morton. Marvin, if you could turn your camera on and state and spell your name for the record, please, you can get started.
Thank you so much. Good afternoon. My name is Marvin, M-A-R-V-I-N, Brown, B-R-O-W-N. I am an attorney at Earth Justice in Washington, D.C. I'm here today to advocate for a strong and protective rule to reduce ethylene oxide pollution. As other commentators have noted, and as EPA acknowledges in the proposal, commercial sterilizers are often located in low-income neighborhoods and in neighborhoods with a higher percentage of Black and Latinx residents. As a result, people living in these neighborhoods have a higher risk of cancer than those of us who do not live near a commercial sterilizer. No one, I repeat, no one should get cancer from a facility that is meant to provide safe, sterile medical devices. But that is not the case today. There is a deep, tragic irony in people getting cancer from medical devices that are supposed to save their lives. And as I've seen over and over again in my work, it is even more tragic when a cancer diagnosis occurs in a medically underserved community and a cancer patient is unable to get access to the same medical devices that has caused their cancer. Thus, it is imperative that EPA use the full weight of its authority to ensure that everyone is able to breathe clean, healthy air. And while there are some strong elements in this proposal, like EPA's affirmation of the 2016 IRIS value and its new requirement for area sources to seek Title V permits, unfortunately, the proposal still falls short of the Clean Air Act's promise of clean, healthy air. Because time is short, I would like to briefly touch upon 2 elements that need immediate strengthening. First, EPA must regulate off-site aeration facilities. As EPA acknowledges in its proposal, ethylene oxide continues to off-gas from sterilized products while they are held in storage. The proposal requires sterilizers to control emissions from sterilized products that are being stored on-site, but does not provide the same protections for materials that are being stored off-site at, for example, warehouses. This is an obvious loophole that is already being exploited by commercial sterilizers. These off-site aeration facilities or warehouses pose a major threat to the health of communities nationwide. EPA must amend the source category definition to ensure that these facilities are also covered by this rule. Second, EPA must include fence line monitoring in the final rule. Communities need to know how much ethylene oxide is escaping facilities and entering into their neighborhoods. In other rules, EPA has found that fence line monitoring helps to reduce emissions from toxic polluting facilities. For example, in the recently released HON proposal, EPA is requiring chemical production facilities to monitor for ethylene oxide. As EPA states in that proposal, quote, fence line monitoring can be effective in reducing emissions and reducing the uncertainty associated with emissions estimation and characterization, end quote. And furthermore, quote, public reporting of fence line monitoring data provides public transparency and greater visibility, leading to more focus and effort in reducing emissions, end quote. Communities living near sterilizers deserve and must have the same level of transparency and visibility that EPA will require in communities living near chemical manufacturing plants. Finally, I would like to urge EPA to shorten the compliance deadline below 18 months. Every week, I talk to community members living near a sterilizer facility who are worried about the air that they breathe. They, like EPA, have known that their air is toxic from commercial sterilizers since 2018, but they have been forced to wait on EPA to act to clean up their air. It has already been 5 years since EPA has known that communities nationwide face heightened cancer risk from ethylene oxide pollution from commercial sterilizers. As you have heard, many have already modified their habits to avoid spending extended periods of time outside in their own neighborhoods. The agency delay has already caused them significant anguish. Please do not make them wait an additional 18 months after the rule is finalized. Thank you for your time and work on this critically important rule.
Thank you, Mr. Brown. I appreciate your testimony today. Panelists, are there any follow-up questions?
And from me, thank you for your testimony.
No questions. Thank you.
All right, next we have Michael Morton. Are you here and ready to testify? All right, when you're ready, if you could state your name and spell it for the record, we can get started.
Thank you for the introduction. My name is Michael Morton. That is spelled MICHAEL-MORTON. I would like to thank the EPA for hosting this hearing and providing the opportunity to offer comments. I would also like to thank the other speakers who have contributed to this important conversation. I'm representing Medical Alley, an association of companies and organizations focused upon healthcare. Medical device innovators in Minnesota founded Medical Alley nearly 40 years ago. Now, Medical Alley and our network of more than 800 member companies represent more than medical device manufacturers. Medical Alley is one of the most diverse and influential healthcare communities in the world. We are a critical partner and connection point between companies and the broader Medical Alley community, which employs more than 500,000 Minnesotans. Medical Alley is deeply committed to a healthy environment. We are committed to advancing health equity and improving patient outcomes for everyone. Our partners understand the significant challenges facing healthcare, with affordability and reducing health disparities as top priorities. It is because of this perspective and expertise that we respectfully offer comments regarding the EPA NESHAP regulation and FIFRA proposal. Our two comments focus upon the potential interruption to access to medical devices and a request to extend the time period for comments on these EPA documents. As you have heard from other speakers, sterilization is critical to the safety of many medical products. The FDA reviews sterility validations when approving a device and in subsequent facilities inspections. The FDA recognizes that ETO is a critical method for sterilization. Now, there are other methods for sterilization, for instance, steam or radiation, but these methods may not be appropriate for the materials or the design of some devices. ETO is an effective method and is used to sterilize about half of all medical devices. ETO is used by contract sterilizers, which can process devices safely and at scale. ETO is also used by smaller independent facilities to process smaller batches of medical products. Currently, ETO facilities are operating at capacity. Disruptions or closing of these facilities would result in a lack of access to medical products. Syringes, vials, surgical instruments could all be affected. Note that manufacturers are working now with the FDA to develop alternative methods of sterilization, for instance, using less ETO. Medical Alley supports reasonable and effective regulation of ETO sterilization and agrees that a review of regulation is due. Regarding NESHAP and FIFRA, we note that these include more than 1,000 pages of highly technical information, and we strongly recommend that the time period for careful review and comment be extended. Thank you again for these hearings, and we look forward to working with the EPA.
Hey, Daryl, you're on mute.
I knew the second I did that. Mr. Morton, thank you for your testimony today. Panelists, are there any clarifying questions?
Have none. Thank you.
None from me either. Thank you very much.
Our next speakers will be Michelle Mapson and Ranjari Bandari. Michelle Mapson, I see you have your camera on. Great. If you could state and spell your name for the record, and you may begin your testimony.
Hey, thank you. Good afternoon. So again, my name is Michelle Mapson. That is MICHELLE-MABSON. I'm a staff scientist with Earth Justice based in Washington, D.C. And I'm here today because while EPA has determined the health risks posed by commercial sterilizers to be unacceptable to communities living near these facilities, if finalized in its current form, the proposed rule would not fully eliminate significant health risks and would fail to protect the public with an ample margin of safety. EPA's core mission is to protect human health and the environment, which includes the use of the best available science in its regulatory process as mandated by law. I commend the agency for continuing to affirm the 2016 IRIS-derived risk value as the best available science for evaluating the cancer risk posed by ethylene oxide and for relying on it in its proposed rulemaking. Further, I thank the agency for conducting a residual risk assessment using its authority under Section 112F of the Clean Air Act. Earth Justice works with community groups that have been impacted by ethylene oxide, including groups represented at today's hearing. It is these communities, many being people of color and low-income communities, that face threats that have led to the finding that their communities live closest to commercial sterilizers, a source category for which EPA has determined emits 23 tons of ethylene oxide per year. In addition to ethylene oxide, EPA's residual risk assessment identified that propylene oxide, which EPA has classified as a probable human carcinogen, as well as ethylene glycol, which EPA associates with kidney toxicity, are emitted by this source category. Together, these pollutants result in a chronic inhalation cancer risk as high as 6,000 and 1 million, with most ethylene oxide operations like pre-aeration handling of sterilized material, aeration room vents, and post-aeration among the major contributors to risk. While my comment today will focus on EPA's residual risk assessment, it should be noted that off-site aeration facilities, as my colleague before me named, results in additional undue health risks to communities and to workers. As part of its risk assessment, EPA determined that the cancer risk from ETO emissions were unacceptable and analyzed two separate post-control options that would reduce the cancer risk from ethylene oxide emissions, with each option resulting in cancer risk between 100 and 400 in a million, respectively. EPA has previously held that cancer risk above 100 in a million poses unacceptable health risks, and Earth Justice, as well as many community groups and scientists, have argued that this benchmark is far too high. EPA did not base its threshold for cancer risk on scientific information about health risk, and in reality, the national average for cancer risk for air pollution falls under and closer to 30 in a million. Allowing communities that have already faced years of undue exposure to ethylene oxide to continue to face nearly 15 times the national cancer risk is unacceptable. Furthermore, while EPA has set a risk value for cancer, it has not evaluated ethylene oxide for non-cancer health effects. In addition to cancer, the Occupational Safety and Health Association and several health studies have linked chronic exposure to ethylene oxide to reproductive effects, including but not limited to increased miscarriages in female workers. And yet EPA fails to acknowledge and account for this additional non-cancer risk, despite the 48,000 pounds of ethylene oxide emitted by this source category each year. To conclude, EPA must act to further reduce the health risks posed by commercial sterilizers. Even after post-control options are applied, cancer risk from this source category alone would still result in risk up to 4 times higher than EPA's own presumptive threshold for safety. We urge EPA to strengthen the rule and to fully eliminate the health harms posed by ethylene oxide, as many throughout this hearing have called for. And thank you for your time.
Thank you for your testimony today. Panelists, any follow-up questions?
I have no questions. Thank you.
I also don't have any questions. Thank you for your testimony.
All right, next I would like to call Ranaja Bandari, and I hope I got that close. You may state and spell your name for the record and begin your testimony when you're ready.
Thank you. My name is Ranjana Bhandari. It's spelled R-A-N-J-A-N-A B-H-A-N-D-A-R-I. I am the director of grassroots environmental advocacy organization in Arlington, Texas. And we usually advocate for protection of residents from the exposure to pollution from Barnett Shale fracking, which is happening all around us. Most of our advocacy is focused on protecting young children and communities of color that do face disproportionate impacts from fracking pollution here. I'm also testifying from my home of 30 years, which is a little over 5 miles away from 2 sterilizers in Grand Prairie, Texas, Sterigenics and Cosmet. And the reason I'm here today is that I very recently learned about ethylene oxide exposure for residents that we work with. So three quarters of the people impacted within a 5-mile radius of these 2 sterilizer facilities are people of color. There are 250,000 people who live in the 5-mile radius. There are 100 schools and childcare centers in that radius. However, the reason I came to learn about this was because I'm going to hold up a diagram. I hope this makes sense. The yellow circle is the 5-mile radius around those 2 black dots that are the 2 sterilizers. That blue star is something called the Truman fracking site in Arlington, Texas. And we've been working in that neighborhood for the last year because of expansion of fracking wells. And in so doing, we learned the following things. In a 1,320 feet radius around that site, based on EPA's EJ screening tool analysis, 83% of the residents are people of color, 54% do not have a high school diploma, 2/3 do not meet federal poverty guidelines, 10% of the residents are children of under 5. However, what was very disturbing was that we also learned that that area is in the highest percentile for air toxics cancer risk. It's in the 95th to 100th percentile. It's in the 80th to 90th percentile for air toxics respiratory hazards, and in the 80th percentile for PM2.5 in the air. I also learned from UCS analysis that there are about 100 additional cases in that 5-mile radius of cancer for every 1 million people, and 79% of them can be attributed to ethylene oxide. So that was really disturbing, and that's what made us look into this, and that's why I'm here today. And because this is not something we normally work on, what I want to say is that I'm here to ask for all possible relief for impacted residents in this area urgently, including air monitoring, and more importantly, measuring of cumulative impacts from all pollution sources, and a moratorium on permitting of new polluting facilities in these impacted communities until these new proposed rules are in place, are implemented in the strongest form possible. Thank you.
Thank you for your testimony. And I would encourage you to submit your written paperwork to the docket that you just showed to us as well. Any follow-up questions from the panel?
I have none. Thank you.
None from me as well. Thank you very much.
Thank you.
Thanks for taking the time today. Our next 2 speakers will be Patrice Tomczyk and Christopher Gillespie. All right, Patrice, if you are ready, you can state and spell your name for the record and get started with your testimony.
Thank you very much. My name is Patrice Tomczyk, PatriceTomczyk. I am the National Field Director for Moms Clean Air Force, an organization of over 1.5 million moms and dads united to protect our children's health from air pollution and climate change. I live in Butler County, located in southwestern Pennsylvania, with my husband and 2 children. I am supportive of the EPA's proposal to significantly strengthen and update standards that would reduce toxic ethylene oxide emissions by 80% from commercial sterilization facilities across the country and to help protect public health. Ethylene oxide is a hazardous air pollutant known to be very harmful to health, and ethylene oxide can cause neurological effects, respiratory irritation, skin rashes, and cancer in humans. Ethylene oxide is a mutagen known to damage the DNA of children and can have really harmful effects in the long run for these children's health. Because children's bodies are still growing and developing, they are vulnerable to air pollution and are expected to be more susceptible to the toxic effects caused by ethylene oxide. Ethylene oxide is used on about 50% of the U.S. medical equipment that requires sterilization, including products sterilized at American Contract Systems in Zelienople, Pennsylvania. American Contract Systems, located about 5 miles away from my home, estimates that it uses 80 pounds of ethylene oxide per month. Zelienople is one of 23 communities across the country that the EPA identified in July of 2022 as having a cancer risk from exposure to ethylene oxide that exceeds 100 cancer cases per 1 million people. Because of this information, there was public outcry from the community, resulting in American Contract Systems installing pollution controls to reduce ethylene oxide emissions. The cancer risk is supposedly lower now as a result of these pollution controls, but it's still very unclear as to how much risk remains for the community members. All commercial sterilization facilities across the country must be required to use air pollution control technologies, practices, and procedures which have been demonstrated to reduce ethylene oxide emissions from these facilities. Because ethylene oxide is so toxic to humans, continuous air pollution monitoring at the facility must be required to ensure that pollution control equipment is operating effectively. This data must be shared with the community and reported to EPA frequently. Also, real-time fence line air monitoring around the perimeter of a facility, along with community website access to the data, should be required to help protect the surrounding community and provide transparency. There must be no pollution loopholes. The EPA must close loopholes that exempt commercial sterilization facilities from certain Clean Air Act regulations during startup, shutdown, and malfunction, otherwise called SSM events. During SSM events, industrial facilities release pollutants at significantly higher levels than during normal operations, and yet are not held accountable for these pollutions, for this pollution due to loophole exemptions. High pollution releases during SSM events can exceed a facility's routine annual emission limits. For families living near the facilities, the cumulative impacts of pollution releases during SSM events increase the risk of cancers and other health issues. EPA must end industry's ability to pollute with impunity through SSM loopholes. Families living near commercial sterilizer facilities should be protected from toxic ethylene oxide at all times, as promised by the Clean Air Act. This rulemaking to reduce toxic ethylene oxide emissions from commercial sterilization facilities has been long overdue. Since 2016, the EPA has known the cancer risk from ethylene oxide to be much higher than previously thought, but has been slow to take action. EPA must propose an expedited timeline.
Your time is up. Thank you.
Thank you.
Panelists, is there any follow-up for Ms. Tomczyk?
I have no follow-up. Thanks for your comments.
I don't have any questions. Thank you very much for your comments.
All right, next, I'd like to ask Christopher Gillespie if you'd like to turn on your camera. You can, is Christopher Gillespie here?
Yes, I'm here. Am I able to keep my camera off?
You are. I'm sorry, you just weren't showing up on my screen, but feel free to state and spell your name and you can get started.
Awesome. Well, I'll keep my camera on today just for solidarity. My name is Christopher Gillespie. That's CHRISTOPHER. My last name is Gillespie, GILLESPIE. And I want to thank the EPA and all of its federal partners in this wonderful rulemaking to be able to address the deleterious impacts of ethylene oxide pollution. We can no longer discuss ETO without invoking the deleterious implication of cancer on the American public. The Cancer Moonshot estimates that we can prevent more than half of all cancers by better applying knowledge we already have. Ethylene oxide, ETO gas, is thought to contribute to roughly 1/3 of the total cancer risk from nearly 140 toxic air pollutants. We can reduce cancer disparities by limiting exposure to risk factors and intercept cancer before it happens. We cannot base the pace of our response to ETO pollution on regulatory standards that veer towards complacency. Past regulatory actions have been reactive. However, reacting to ETO pollution in an urgent capacity does not mean that the response is reactive. It means we value families and our customers. The Clean Air Act, CAA, U.S. Code, Section 7401, Title 42, is a comprehensive federal law that regulates all sources of air emissions. The Environmental Protection Agency, the EPA, has the necessary tools to protect our families from a number of harmful pollutants. But the EPA are not the only ones with the means to act. Commercial sterilizers and hospital sterilizers also possess the tools to mitigate ETO pollution and cut the cancer death rate in half. While there are a number of potential alternatives to ethylene oxide, any alternative should be accepted and chosen with communities in mind. This does not mean that communities, companies, government agencies, and early career scientists like myself need to endure this invisible and inequitable threat. I live only 5 miles away from Anderson Scientific, a known emitter of ethylene oxide. Ethylene oxide emitters will argue today for many medical devices. Sterilization with ethylene oxide may be only the method that effectively sterilizes and does not damage the device during the sterilization process. However, in the 1990s, the same might have been said for animal source insulins, which is now no longer the only source of this life-saving drug. Innovators made synthetic insulin possible and rapidly to meet the growing demand of the market. They did this because there was a need we now see in the medical device sterilization space. By placating ethylene oxide source emitters with delays, we are stifling responsible innovation. There are plenty of emerging alternatives to ETO that have yet to reach critical market scale because companies have not been proactively investing in these solutions to bring them from prototype to mass market adoption. I would like to end by saying, responding urgently to this issue is not only necessary, but provides incentives to companies with alternatives to ETO to be identified, scaled to meet demand. And I want to thank the EPA for this proposal, and I hope that we can strengthen it to protect communities. Thank you.
Thank you, Mr. Gillespie, for your testimony today. Panelist, is there any follow-up questions?
I have no questions. Thank you very much.
None from me. Thank you for your testimony.
All right, before I invite up our next speaker, I just want to remind people providing testimony today to please speak slowly for the interpreter so that they have time to provide this in Spanish. So our next speaker will be Grace Wickerson. Grace, are you?
Yeah,
I see you there. Wonderful. If you would state and spell your name, you can get started with your 4 minutes of testimony.
Okay, great. So my name is Grace Wickerson, GraceWickerson. Thank you for allowing me to provide testimony today. I am an early career scientist and a science policy fellow, where I focus on the intersections of health equity, and environmental justice. And considering that my background is in medical device engineering and development, I understand the critical role that ethylene oxide plays in the development and sterilization of essential medical technologies. When we know that 90% of the surgical equipment kits that are used in hospitals to provide essential care can only be sterilized in this moment by ethylene oxide, we understand that any kind of regulation to this essential chemical feels like a threat to much of the health systems in this country. But another existential threat, as my colleague Christopher Gillespie said in his talk right before me, is that this chemical that is so essential to public health in the hospital system is actively causing cancer at sites across the country. And so understanding that this is a space where huge demand exists for this chemical, we need to be regularly investing in the innovative technologies that are alternatives to ethylene oxide in response to the new regulations that are coming down from the EPA. And that this can actually be a critical part of the broader administration's goal in industrial policy. A potential ability for us to use market shaping mechanisms that were utilized during the COVID-19 pandemic and Operation Warp Speed to provide swift and collaborative response to reducing ethylene oxide emissions. In many ways, I believe this can be a win-win, reducing ethylene oxide emissions that are harmful to the health of communities, while also spurring innovation towards new technologies that are not cancer-causing as they embed themselves into people's air and also their water and soils, having many downstream effects on the environment. I think industry partners should be acknowledged in their concerns regarding turnaround, but be motivated and encouraged to join in the urgent response to addressing ethylene oxide emissions. If commercial partners think there's not enough time to move faster, then we should move smarter, thinking about the rapid investments in innovation that could drive alternatives such as heat sterilization, chlorine dioxide gas, and radiation as fast-moving alternatives that don't require a gas that can cause cancer and threaten much of the administration's goals to reducing cancer and cutting the cancer death rate in half. I think addressing ethylene oxide emissions doesn't need to immediately evoke overhaul of ethylene oxide at each source emitter. We can actually be more iterative, starting with more proactive measures such as installing fence line monitoring, ambient air monitoring, and off-gas monitoring systems to understand and scope out the full extent of the problem and ensure that emitters are proactively working towards the 80% reduction in emissions as recommended by policies. I believe that there should be really no competition between the two factors of reducing our cancer rates and increasing access to sterilized medical devices. I support this current proposal from the EPA and its expedited timeline for facilities to meet emissions requirements and believe it's a necessary step towards not only protecting communities, but optimizing sterilization services and possibly driving it towards a more cost-effective and safe method for all Americans to ensure access to medical devices. So thank you so much for your time, and I'll cede it to the panel and answer any questions.
Thank you, Grace, for your testimony today. Any follow-up questions from the panel?
I have none. Thank you for your testimony.
Thanks for your testimony. I don't have any clarifying questions.
All right, at this time, I would like to ask if there is anyone here in the Zoom call that would like to provide testimony that has not had the opportunity to do so yet. If you do, please raise your hand. I'm not seeing anyone. But then again, maybe if there is not anyone who would like to provide testimony, we're going to proceed with a short break. So I would just like to say my name is Daryl Weatherhead, and I've been chairing this hearing session today. I want to thank everyone who shared their comments so far on EPA's proposed actions. If you have questions about today's hearing or are interested in registering to speak, please send a direct message to attendee support in the chat box. If you're joining us by phone, you can raise your hand by pressing *9, and our logistics team will reach out to you. At this time, we're going to take a short recess, and we'll resume the hearing in 15 minutes, which I guess would be about 2:25. Welcome back from break. My name is Daryl Weatherhead in the Office of Air Quality Planning and Standards, and I am chairing today's session on EPA's proposal to reduce ethylene oxide emissions from commercial sterilization facilities. I believe we have one more registered speaker today. Tracy Fish, are you here? If you're here, could you raise your hand? I would also like to ask if there's anyone who has not had a chance to speak and would like to speak, if you could raise your hand. Not seeing anyone and wanting to give opportunity for those people that were registered, I'm going to suggest that we take another 15-minute break and resume around 2:40. All right, with that, we will be back in another 15 minutes. Thank you. Welcome back from the break. My name is Daryl Weatherhead, and I am the group leader of the Air Economics Group in the Office of Air Quality Planning Standards. And I am chairing today's session on EPA's proposal to reduce ethylene oxide emissions from commercial sterilization facilities. I wanted to check again to see if there is anyone here on the call that has not had a chance to provide their testimony yet today. If you would like to provide testimony, please raise your hand. And I am also wondering if registered speaker Tracy Fish is here yet. All right, not hearing any responses for anyone who would like to provide testimony. I would like to say that this hearing is going to go into recess. Again, my name is Daryl Weatherhead. I've been chairing this hearing session today. At this time, there are no additional registered speakers for this session. I want to thank my fellow panelists and everyone who stayed to offer testimony today, and everyone who took time out of their schedules to listen to today's hearings on EPA's proposal to reduce ethylene oxide emissions from commercial sterilization facilities. As a reminder, you can submit written comments on this proposal through June 12th, 2023. We will now take a recess, and the next session of this hearing will begin at 5:00 p.m. Thank you.
Welcome. Welcome to the ethylene oxide sterilizers proposal public hearing. We are providing a Spanish interpretation for today's hearing. So to listen to the hearing in either English or Spanish, everyone will need to select a language at the bottom of your screen. Click on the globe icon and then select either English or Spanish. My name is Keith Barnett. I am a group leader in EPA's Office of Air Quality Planning and Standards. I will be chairing this session of the virtual public hearing. Thank you for taking the time out of your day to share your comments on EPA's proposal to reduce ethylene oxide emissions from commercial sterilization facilities. This proposal, which EPA announced on April 11th, 2023, would significantly strengthen and update Clean Air Act standards for ethylene oxide, also referred to as ETO, emitted from the air from commercial sterilizing facilities, also called commercial sterilizers. The proposed rule is estimated to cut emissions of ETO from these facilities by 80% when the rule is implemented. Now, I'd like to ask our other EPA panelists to introduce themselves. On the panel are, and Lisa, if you would go first.
Thanks, Keith. I'm Lisa Connor with the Office of Air Quality Planning and Standards.
And Matt.
Hi, I'm Matt Minipella. I'm a team leader in the Office of Chemical Safety and Pollution Prevention. I work in the Antimicrobials Division.
All right, thank you. We are also joined today by a transcriptionist who will produce a written transcript of today's hearing. We will add the transcript to the public docket for this rulemaking and will carefully consider your comments as we develop a final rule. Okay, before we begin the hearing, we have a few ground rules and housekeeping items to review to make today's hearing run smoothly. First, EPA is committed to an environment of mutual respect and safety. We want to hear your views on the proposed rule today. However, the agency will not tolerate harassment, discrimination, intimidation, inappropriate language and images, or sustained disruption of the public meeting, of the public hearing. EPA expects everyone participating in this hearing, including registered speakers, attendees, and those of us on this panel, to conduct themselves in a respectful and civil manner. We will monitor and moderate this virtual event to ensure that common standards of decency are upheld. Please note, by registering for this event, you are agreeing to abide by the ground rules of the virtual hearing. Now let's move on to how the hearing will actually work. If you registered to speak, you should have received an email notification that included an approximate time window when you to speak. We will do our best to stick as close to that time as possible. If you have joined us through Zoom, please keep the chat box open. It is at the bottom of your screen. We will put the names of the next speakers in the chat box. We also may use the chat to communicate directly with you. I will call on each speaker when it is their turn. Let me apologize in advance for any mispronunciations of your name. When I call on you to speak, please unmute your line. If you are joining us via Zoom, that's the button on the lower left of your screen. If you are joining us by phone, you can mute and unmute yourself by pressing *6. Please state your first and last name and spell it for the record. When you are providing testimony, you are welcome to activate your video camera by clicking on the Start Video icon at the bottom left of your screen. If you are not testifying, please keep your camera off. Each speaker will have 4 minutes to give comments. A 4-minute timer will be displayed on the screen to help you keep track of your time. The timer will start when you state your name. When your 4 minutes are up, it's time to stop. If you are testifying by phone, the timekeeper will alert you when you have 1 minute remaining. To be fair to everyone, we are going to strictly enforce the 4-minute limit. If you have additional items you would like to share, such as slide presentations or videos, you may submit them to the docket for the proposal through June 12, 2023. And at various times, we'll be showing notes on the screen which list the dockets and how to comment on the rule. We encourage you to also submit a written copy of the testimony you provide today. We will post information on how to submit written comments in the chat box throughout the hearing. We are here to listen to you today. However, panel members may ask questions to clarify your comments. When you are finished speaking, please remain on the line until I am able to confirm that there are no further clarifying questions from our panel. Once we are done, please remute your line and turn off your camera. I will call the next speaker and so on. If time allows, we may be able to add additional speakers. If you did not pre-register and are interested in speaking, please send a direct message to the attendee support in the chat box. Our logistics team will let you know if there are any time slots available and assist you with registering. Today's hearing consisted of 3 sessions. The morning and afternoon have already been completed, and this is the evening session. If there are no additional speakers, we may close a session for 15 minutes after the last registered speaker has testified. We may also take short breaks as needed. Thank you again for taking the time today to share your comments on EPA's proposal. So let's get started. And the first 2 speakers of our evening session will be Rob Owen and Emma Sherman.
Good afternoon. My name is Rob Owen, that is spelled R-O-B-O-W-E-N, and I'm the Executive Director of Bio Nebraska, a nonprofit trade association dedicated to supporting, promoting, and growing the biosciences in Nebraska. Bio Nebraska has over 100 member organizations representing the human health, animal health, agriculture, industrial, biotech, and renewable fuels sectors. Member organizations also include the University of Nebraska and its 4 statewide campuses, Southeast Community College, and Metro Community College. According to recent statistics, there are over 18,000 jobs in Nebraska associated with the biosciences, including roughly 3,000 jobs tied to Becton Dickinson, which has facilities across the state and is one of the largest private sector employers in Nebraska. The average wage for those bioscience jobs in Nebraska are $82,000, which if you compare to the average private sector wage of $54,000, we can conclude that the biosciences are providing high-wage, high-quality jobs and are an important component of growing Nebraska's economy. On behalf of Bio Nebraska and its over 100 member organizations, I'm providing comments on the EPA's proposed rule to reduce ethylene oxide emissions from commercial sterilization facilities. As background, ETO is one of the most common ways to sterilize medical devices. Approximately 50% of all medical devices, or 20 billion, are sterilized each year in the United States. Both the FDA and the EPA agree ETO is a critical sterilization method. For many of these medical devices, ETO sterilization is the only viable method. ETO allows for sterilization of many critical medical technologies and devices that would be destroyed and rendered unusable by other sterilization methods. My previous position as general counsel of Streck, a medical device manufacturing company in Omaha that worked on blood collection tubes and hematology control products, I saw firsthand the effects of sterilization. Many times our blood collection tubes, which were glass, would come back from the sterilization process. They would be, couldn't see through them, cloudy and such, which would make them unusable. So I know the importance and I've seen sterilization up close and personal. Then touching on capacity here on ETO sterilization, as we all know, is at capacity, meaning that long shutdowns or permanent closures would significantly disrupt patient access to sterile medical devices. This would be disastrous to patient safety, the daily practice of medicine, and overall public health in the United States. All parties involved, the EPA, the FDA, and the medical device industry are committed to one outcome, which the medical device industry has long been committed: a safe sterilization process that protects employees and the communities surrounding these facilities, and maintaining an uninterrupted supply of safe medical technology and supply for millions of American patients and physicians every day. However, the EPA's proposed regulations are being put forward on a short implementation timeframe with a very short comment period. In order to fully understand the proposal and its effects on patient safety and properly digest over 1,000 pages, a longer comment period is needed to review and comprehensively comment on a rule impacting patient access to critical medical technology. Additionally, we are concerned that patient safety will be immediately at risk if the rules as proposed are finalized too quickly and do not reflect the input and guidance of all necessary parties. The medical device industry is continually identifying how it can lessen its impact on the environment, including reducing the use of ETO. However, until the best alternatives can be identified, according to the FDA, quote, other methods of sterilization cannot currently replace the use of ETO for many devices, end quote. We hope the EPA will take our comments into account and work with us on a final regulation that ensures continued patient safety while achieving the EPA's goal that which we share of protecting community members and employees. With that, my comments are over. Thank you.
I have to remember to unmute myself. Thank you for your testimony. Do the panelists have any questions? No? Okay. Thank you very much. And then we'll have the next speaker.
Hello, everyone. My name is Emma Sherman. That's Schurman. My first name is EMMA. I am speaking to you today from Hudson Falls, New York. I live a couple of miles from a sterilizing facility here in New York. I am also in the area of the state of New York, not coincidentally, with the highest cancer rates in the state. My neighbors, I'm speaking on behalf of my neighbors today. We have been speaking amongst ourselves, about this issue, including many people who are currently suffering from cancer and believe it is attributable to the long-term exposure that they've suffered from the local facility that we believe has been unsafely emitting levels of ETO. I am speaking today in support of these proposed regulations, particularly the aspect in which monitoring will be increased. The facility that is nearby to my house is only required to take a measure of what's being emitted once annually. Currently, ambient monitoring or fence line monitoring is not required. So we have only the facility's assurance that those levels are the same throughout the year and that they are safe. I have a neighbor who is an ETO monitor that he has on his fence that he says goes off all the time. He's contacted the facility. They've said that's just what happens when you live by a facility. I, of course, understand the critical importance of having sterile medical equipment, and I absolutely support that. But I do not believe that that needs to happen at the cost of the health and safety of me and my neighbors. There is a daycare that is in close proximity to the facility. There are multiple schools that are in proximity to the facility. So once again, I am speaking in fervent support of these increased regulations that will support the safety and the well-being of my community. Thank you so much. Oh, I believe you're still muted.
And then I turned my video off by mistake. Thanks for your testimony. Do the panelists have any questions?
I don't.
All right. Before we go to the next two speakers, I have a couple of other things I wanted to add here. One, I wanted to mention that we do have an interpreter, as we mentioned at the beginning of the hearing, and we do ask. I realize that people tend to want to speak fast because they want to be sure they get all their testimony in before the 4 minutes are up. But we do ask that you maybe slow down a little bit and pause to take a breath so our interpreters can keep up with you. And the second thing is If you're watching the hearing on YouTube and you would like to register to speak, you can send an email to eto-sterilizer-public-hearing@rti.org. And the next two speakers will be Jeff Lair and John Ray.
Thank you. Can you hear me all right?
We hear you.
Okay, great. My name is Jeff Lair. I'm directing my comments to docket ID number EPA HQ OAR 2019-0178. I'm a Memphis resident, and my home is located about 7 miles northeast of Sterilization Services of Tennessee in the University of Memphis area. I've been an occasional volunteer for Memphis Community Against Pollution, a Black-led grassroots movement that is advocated on behalf of the Mallory Heights community near the sterilization facility. And I attended one of MCAP's meetings with those community members last October. I'm also the co-lead for the Tennessee at Large chapter of Citizens Climate Lobby. CCL is a nonprofit, nonpartisan grassroots advocacy organization focused on national policies to address climate change. Through over 600 local chapters organized by congressional district, we advocate for effective legislation and policies that will significantly reduce emissions while protecting people from undue economic burden from the policy. CCL also recognizes that climate change disproportionately affects people with fewer resources and less political influence, and work toward effective solutions that do not harm those most vulnerable or under-resourced. As someone who once lived with daily emissions coming from a cottonseed processing plant in North Memphis in the mid-'80s, I know what it's like to wonder what you're breathing, and to hear from public health officials that those emissions are within legal standards and that my air quality is fine, even if I might find it unpleasant. I didn't pursue that further, partly because I was able to move out of that neighborhood. I can only imagine what it was like for longtime residents of Mallory Heights to receive that EPA letter last August admitting ethylene oxide is 60 times more dangerous than previously thought, and later to learn EPA regulations don't account for the fugitive emissions that account for about 85% of ETO releases. I want to thank EPA for the work it's been doing on behalf of the Biden administration to reach out to communities affected by ETO across the country, particularly those who've been long subject to racial disparities for environmental hazards. I think I can also understand why deadlines have been missed, considering the New York Times January 23rd reporting on the agency's struggles to recover from an exodus of more than 1,200 scientists and policy experts when the previous administration left the agency neglected and scientifically compromised. While I'm glad the climate and infrastructure law enacted last year made much needed funds available to help address environmental hazard disparities, the fact that your overburdened staff must now pursue regulatory and environmental enforcement work while also administering and managing these funds is worrisome. In that context, I wonder how much leverage this gives the polluters who lobby for more lax timelines and less stringent measures. As other MCAP advocates have noted, this community deserves a much faster implementation time for reducing ETO pollution. EPA is already 15 years late in reviewing the rule and 7 years late in incorporating the IRIS risk assessment data into the new rule. The community was first informed last August that for 50 years they've been subjected to ETO exposure at rates up to 20 times the agency's acceptable risk level. The agency can require an implementation period as short as 90 days, and it should do that. Effective community air monitoring is also essential for checking on highly carcinogenic pollutants, and monitoring at the fence line or beyond is needed to put this community at ease. The rule will also need effective measures to ensure the enclosures are meant to capture fugitive emissions, especially considering EPA admission of the Memphis community that these emissions were the cause of excessive cancer risk here. Thank you for the opportunity to comment.
Thank you for your testimony. Do the panelists have any questions?
Nothing for me. Thank you.
Okay. Thank you, Mr. Lair. And the next speaker, please.
Sure.
Good afternoon. My name is John Ray, John-Ray. I am Executive Director for the Florida Medical Manufacturers Consortium. The FMMC is a statewide association of medical product manufacturers and allied industries. We've been around for about 20 years. We exist to support and unite the medical device industry in our state. Florida is a major medical product manufacturer. We support over 700 medical device facilities in our state, representing over 20,000 direct jobs, paying an average wage of over $76,000 a year. These are high wage, high value added jobs. Our medical device industry, like the entire nation, is so important to our economy. America is a world leader in the research, development, and production of life-saving, life-prolonging medical devices. Medical devices are useless unless they are sterilized. Over 40 billion medical devices are sterilized every year domestically. 20 billion of those devices utilize ETO modality. I'm coming to you tonight from St. Petersburg, where we just concluded our 2-day annual conference of our industry. At that conference, we talked about a whole host of issues that are of great concern and opportunity for our industry. And I can tell you that the issue of sterilization, the impending regulations, which are, in our view, have an incredibly short time period and are incredibly onerous and do not reflect a patient and reflective discussion about appropriate use, risk, and utilization of alternative technologies. One thing was very clear in our conference. Our industry, our manufacturers, our contract sterilizers have long been working together to reduce ETO loads, revalidating cycles to reduce the use of ETO. But right now, ETO represents 50% of our industry, and a large subsection of that, there currently exists no viable, approvable different modality for many, many medical devices that we depend upon for healthcare delivery in this country. We need a longer comment period. An 18-month implementation timeline would create sheer chaos in our industry and certainly will deliver shortages and healthcare outcomes that do not correspond in line with the risk. So I beg you to consider a longer comment period and a longer implementation timeline as we come up with alternatives to comply with the new controls. Our industry has been producing medical devices safely and effectively for years, and the sterilization process deserves a much more patient and unified discussion and a realistic discussion about what alternatives and what is considered appropriate risk for what is a profound interest of our nation, which is our medical device industry and the patients that we serve. Thank you for your time.
I'm sorry. Thanks for your testimony. Do the panelists have any questions?
Nothing, thank you.
All right, thanks. Okay. The next two speakers will be Vanessa Perez and Jayla Atkinson.
Okay, hold on. I have to unmute my video, right?
As far as your camera, that's up to you. Just you do need to unmute yourself, but other than that. It's up to you if you want to turn your camera on.
Okay, I could turn it on. Hold on. I think I turned it on. Okay. Is my time starting now?
Yes, ma'am.
Okay. My name is Vanessa Perez, and I am the Mayor Pro Tempore for the City of Laredo. And I'm also a co-founder of the Clean Air Laredo Coalition. I'm here to speak today on the EPA's rule, and one of the facilities in our community is Midwest Sterilization, which is the largest emitter of ethylene oxide in the country. And that's only based off of their own self-reported data. 24 hours a day, 7 days a week, which is how often that they operate. And that has subjected our community to an unacceptable amount of exposure to this known pesticide and carcinogen. TCEQ has given this sterilizer and others around the state a free pass to pump a carcinogen into the air that we breathe. This chemical is so small and dangerous that we can't even protect ourselves from it if we wanted to. It can penetrate almost any material and is known to alter DNA in living organisms. How can EPA, as the standard for state agencies, allow something so dangerous to be emitted out of buildings? With today's technology, businesses can do better to capture these emissions, but it's obvious they won't do it unless they are required to. Additionally, monitoring has been missing for far too long. You cannot control that which you do not measure, and also trust but verify. These are two significant pieces of wisdom we learned in grade school that the EPA has failed to implement into its own mission. We cannot allow businesses to self-report without proof. We need to have a plan in place for the third-party monitoring, and we need to make sure businesses, as good corporate citizens, carry the responsibility for this. Texas Department of State Health, after some reluctance, released data on cancer rates in Laredo. The known cancers caused by ethylene oxide are on the rise in our community surrounding this facility. We cannot ignore this fact. Those are just the known cases. As you know, our proximity to Mexico allows citizens the option to get treated across the border. Therefore, those numbers are not included in the report. I represent the residents and business owners around this facility. We are underserved and have a large population of economically disadvantaged citizens, while also being severely underserved medically in our community. EPA just released information that employees have a 10% chance of contracting cancer if they work at this facility or facilities that sterilize medical equipment or release ethylene oxide. Well, our outreach is showing this to be true, not only for that particular business, but surrounding businesses as well. The health of our people should be all of our number one priority. Everyone at EPA should be on the same page with this philosophy. Money is not the most important factor in our decision-making, and as public servants, it should never be. Industry has their talking points. Science tells us the facts. They ask for patience, we ask for urgency. This is a life-threatening situation, and we're asking for action to be taken now. Listen to the science. ETO causes cancer and mutates DNA. We have no business breathing it in. What is the future going to be like? Ethylene oxide is also allowed to be off-gas in secret warehouses. We need transparency. We need to require products to remain in a controlled facility to off-gas for however long it takes before transporting projects to the open air where ethylene oxide can just fly into our children's lungs. People I know and love are getting diagnosed with cancer. We need sterilized medical equipment, but we cannot live without clean air. Clean air is a human right. We can't sacrifice one at the expense of another. Protect the future. Ethylene oxide needs strict regulation. The rule change is better than what we have now, but it's not the best that you can do. Maya Angelou said, do the best you can until you know better. Then when you know better, do better. EPA, please do better.
Yeah, I was gonna say, please wrap up, but thank you for your testimony. We appreciate it. Do the panelists have any questions?
Thank you. Nothing for me.
I was wondering some of the data on the cancer rates and other data that you mentioned. If you have an opportunity to submit that to EPA, it'd be very helpful.
Yes. Who do we submit it to? Because it was released by the Texas entities. It's on their website, but we can forward a copy off to whoever. Well, who do we need to send that to?
You send it to
You
the
can go ahead, Keith.
rulemaking docket.
The
And we've, yeah, it's yes, it's in the chat right now to submit written comments.
Okay,
And, so it's just the rulemaking docket for this rule.
okay, thank you.
Yes, ma'am. And of course, Jayla Atkinson is next.
Hi, everyone. Thank you for the opportunity to speak today. My name is Jayla Atkinson, and that's spelled JaylaAtkinson. And I am the youth community organizer for Clean Air Now. I work to try and help kids understand and grasp what is going on in our environment and how it impacts their health. I prioritize giving them the tools and perspective they need to feel hopeful about the future. I'm here today because I want to emphasize how important it is that we protect the youth of our world from harmful pollutants like ethylene oxide. Children are especially vulnerable because their cells are dividing rapidly as they grow, and ethylene oxide can damage DNA in their cells and negatively impact them in extreme ways for the rest of their lives. These children did not ask to be put in this polluted world. And as adults who are privileged to have access to all this information, we have a responsibility to do something to protect youth. In Kansas City, Missouri, where I live, there is a facility that emits ethylene oxide, and within 5 miles, there are 116 schools. Children should never be put in this situation. Some of the youth that I work with live in heavily polluted, underserved environmental justice communities, and they are not only exposed to ethylene oxide, but they are exposed to a range of hazardous pollutants that are not being measured by the EPA. We need more fence line air monitoring to make sure our most vulnerable populations are protected. We need to switch to safer alternatives to ethylene oxide like hydrogen peroxide as soon as possible. Knowing that there is a safer alternative, it would be criminal to not make the change. I've heard other people speak about hydrogen peroxide not ready to completely replace ethylene oxide. And I haven't done all of my research in depth on that. It's not really in my job description, but if that's true, then maybe we just need to use hydrogen peroxide for some of the things that it works with, and then use ethylene oxide for the things that it works for. And maybe that would help us see the decrease that we want to see in emissions. I think it's essential to get creative in our solutions like that. I know how important it is to sterilize our medical equipment, but why do some people have to suffer from the pollution while others do not? I think we really have to do better here. It feels awful to look kids in the eyes and tell them that some people have clean air and others do not. They ask why. Why should some people suffer from one thing while others are benefiting from it? It is hard to answer these kinds of questions, and it is hard to feel hopeful for the future for these kids. But I do my best to stay positive and show them that there is a way to create change. So help give me something positive to share with them and pass the most strict regulations possible on ethylene oxide. And while you're at it, let's start tackling these other hazardous air pollutants as well. We cannot let the youth of our world grow up like this. They deserve better. And thank you. That's all I have.
Thanks for your testimony. Do the panelists have any questions?
Nothing, thank you.
All right, thanks. All right. The next two speakers will be Tracy Frisch and Lisa Nurnberger.
Okay, thank you. My name is Tracy Frisch, Frisch, TRACY, and I'm the chair of the Clean Air Action Network of Glens Falls, New York, a group that we formed in 2019 to prevent industrial air pollution and protect public health and the environment. We are a 3-county citizens environmental group. According to the New York State Department of Health, Warren County, where we are based, has the highest cancer rates in the state. When a neighborhood group of residents living within a half-mile of Sterigenics, one of the medical device sterilization plant that uses ethylene oxide in our area, formed, and this group was formed a couple of months ago. The first meeting, 3 of the 15 people who attended were women who have or had breast cancer. In addition, the census tracts closest to the plant have the highest rates of the 2 cancers associated with ethylene oxide that are measured at the census tract level, according to the New York State Cancer Registry. And those are non-Hodgkin's lymphoma and breast cancer. People living near a medical device sterilization facility should not live in fear because of their exposure to ethylene oxide. They should not bear the risk of becoming casualties in order for medical devices to be sterilized. Measures should be taken to ensure that community health is protected, as well as worker health. So our organization strongly supports stronger regulations, including such as stricter control systems to capture and detoxify ethylene oxide in these plants, stricter monitoring of these control systems to ensure that they function effectively, continuous emissions monitoring of ethylene oxide with data posted in real time on a public website, as well as fence line monitoring with immediate disclosure of data through such a public website. We also strongly support requiring such medical device sterilization plants using ethylene oxide obtain federal Title V air permits rather than allowing them to get by with state air permits. In New York State, a state air permit lasts for 10 years and requires far less frequent air monitoring. We also support accelerated implementation of stricter rules. There's nothing more important than protecting public health. Thank you very much.
Thanks for your testimony. Do the panelists have any questions?
Thank you. Nothing for me.
All right. Thanks, guys. All right. On to the next speaker. I'm trying to minute. Or excuse me for a minute. Yeah, that would be Lisa. Lisa, I think you're still muted.
Thank you. Apologies. My name is Lisa Nernberger Snyder. I'm the media director at the Union of Concerned Scientists, but today I'm joining as a resident of an affected community. I live about 2 miles from 2 elite spice plants located roughly 3 miles apart that use ethylene oxide to sterilize spices and dehydrated vegetables. According to previous information released by the EPA, ethylene oxide emissions from both plants exceed the federal cancer risk threshold and contribute to elevated cancer risks in the community. I look forward to EPA scheduling a community meeting so that my neighbors and I can get information about the potential risks from these plants and how the new EPA rules will apply to them. Chronic exposure to ethylene oxide is associated with cancers of white blood cells, such as non-Hodgkin's lymphoma, as well as breast cancer in women. Children are especially vulnerable to ETO exposure. It can make them susceptible to DNA mutations. EPA's own science confirms that ethylene oxide is extremely toxic to breathe. Like me, the people who live or work around these plants had no idea that the plants were using a carcinogenic gas to sterilize food and spices. For the past 15 years, I've been bike riding near the 2 plants and less than a mile from the plant in Jessup. If it were not for my job, I may not have ever known about these risks. I've spoken with many community members and employees and businesses next door to Elite Spice who had no clue this toxic gas is being emitted. I commend the EPA for developing regulations to reduce ETO emissions and for relying on the 2016 IRIS risk assessment for establishing these standards. I believe that this administration truly puts public health first, which is a huge relief after living through the previous administration. I really want to express my gratitude. I understand that ETO is still necessary for sterilizing some medical equipment, and the FDA is working to identify substitutes. but it seems that ETO could be eliminated from sterilizing spices. The European Union bans the importation of spices sterilized with ethylene oxide, primarily because the material can remain in the product. Meanwhile, McCormick uses steam to sterilize all of the spices we buy off the shelf here in the US. I understand that ethylene oxide residues are not a major risk for spice products, but what I am concerned about here is not the safety of the food products, but of the emissions from the facilities. If there are safer methods for sterilizing spices that do not generate emissions of a cancer-causing gas, they must be employed. I also urge EPA to require fence line monitoring to cover off-site warehouses in this rulemaking and to proactively communicate the risks to affected communities in appropriate languages. Thank you again for the chance to testify. I urge the EPA to adopt the strongest standards possible for this toxic chemical.
Thank you for your testimony. Do the panelists have any questions?
No, thank you.
All right. Well, at this time, we don't have any registered additional speakers ready to speak. If you have not provided testimony, but you would like to, please send a chat to attendees support, and we will get you added to the list. If you have not spoken but would like to speak, please send a chat to attendees support. Oh, excuse me. I just read the same thing twice. If you're watching the hearing on YouTube and you would like to register to speak or have questions about this proposal or today's hearing, please email. Again, it's ETO-sterilizer-public-hearing@rti.org. And so since we do not have any registered speakers ready to speak at this time, we are going to take a short 15-minute break. My name is Keith Barnett. I've been chairing this session. We want to thank everyone who has shared comments so far on EPA's proposed action. Remember, if you have any questions about today's hearing or are interested in registering to speak, please send a direct message to attendee support in the chat box. Or if you are joining us by phone, you can raise your hand by pressing *9. And our logistics team will reach out to you and let you know if there are any time slots available. At this time, we were going to take a short recess. We'll resume the hearing about 2 minutes before 6 in 15 minutes. Thank you. Welcome back from the break. My name is Keith Barnett, and I'm a group leader in EPA's Office of Air Quality Planning and Standards. I am chairing this session on today's hearing on EPA's proposal to reduce ethylene oxide emissions from commercial sterilization facilities. As a reminder, we are providing Spanish interpretation for today's hearing. I want to remind you that today's hearing is being recorded and transcribed to produce a written transcript of the hearing. We will add this transcript to the public docket for this rulemaking and will carefully consider your comments as we develop a final rule. And also a reminder to listen to the hearing in either English or Spanish. Everyone will need to select a language at the bottom of your screen. Click on the globe icon and then select either English or Spanish. If you have questions about today's hearing or are interested in registering to speak, please send a direct message to attendee support in the chat box. If you are joining us via phone, you can raise your hand by pressing *9. Our logistics team will add you to today's agenda if there are any time slots available. Please note, by registering, you are agreeing to abide by the ground rules of the virtual hearing. That includes rules of behavior. EPA is committed to an environment of mutual respect and safety. The agency will not tolerate harassment, discrimination, intimidation, inappropriate language and images, or sustained disruption of the public hearing, event, or the meeting. EPA expects all participants, including panelists, registered speakers, and attendees, to conduct themselves in a respectful, professional, and civil manner. We will monitor and moderate this virtual event to ensure that common standards of decency are upheld. A quick reminder about providing testimony. When I call on you to speak, please unmute your line. While you are providing testimony, you are also welcome to activate your camera by clicking on the Start Video icon. Please state and spell your name for the record. A 4-minute timer will be started when you state your name. At the present time, it does not seem that we have any other speakers registered. We will be keeping the public hearing open for at least 15 minutes. If you have not provided testimony but you would like to, again, please send a chat to attendee support and we'll get you added to the list to speak. Okay. And we have a speaker. Okay, our next speaker is Andres Fuentes.
Hello, can you see me, right? Okay. Perfect. Good afternoon, everyone. My name is Andres Fuentes Teva, Andres, and I work with Clean Power Lake County, a nonprofit environmental justice organization based in Waukegan, Illinois, as an intern assistant for the Ethylene Oxide emissions project. Our organization is dedicated to fighting for environmental justice and a sustainable future in the Lake County communities. Today, I want to talk about the impact of ETO on our community and the urgent need for fence line monitoring strategies and controls of fugitive emissions. Lake County is home to 2 facilities that use ethylene oxide, Medline Industries in Waukegan and Banter Specialty Chemicals in Garni. Both of these facilities emit significant amounts of ethylene oxide, which has been linked to cancer and other health issues. In fact, a recent study by the EPA found that communities surrounding facilities that emit ETO face a cancer risk that is even 30 times higher than the national average. But this is not just a statistic for us. This is a real life situation that we have to deal with every day. People in our community are getting sick and they deserve to live in a healthy and safe environment. We cannot continue to prioritize profits over people's life. Furthermore, the COVID-19 pandemic has made this issue even more urgent. Studies have shown that people living in areas with high levels of air pollution are more likely to suffer from severe cases of COVID-19. Given that Lake County has been identified as a COVID-19 hotspot, it is essential that we take action to reduce emissions and protect public health. Even though the EPA has suggested good ideas, they need to be even more encompassing. That's why we're calling the EPA to implement fence line monitoring strategies. Fence line monitoring is a critical tool that allows communities to track emissions and hold polluters accountable. We know that this is a very complex issue, but we also know that this is a matter of life and death for many people in our community. That's why we're here today, urging the EPA to take immediate action to protect our health and our environment. Finally, we need to remember that this is not an issue for Lake County. Communities across the country have been exposed to dangerous levels of ETO and other pollutants. By taking action to address this issue, we can set a precedent for their communities to follow and create a safer, healthier future for everyone. Thank you for your attention, and please join us in the fight for environmental justice.
Thank you for your testimony. Do the panelists have any questions?
Nothing for me. Thanks.
All right, thank you. At this time, we still have no additional speakers. We will keep the, after the last speaker, we will keep the session open for another 15 minutes. So at this time, I guess we will take another break. We're going to go on another break for 15 minutes, and then we'll check back in. Thanks. Welcome back. It looks like at this time we have no more speakers. I will ask again if anyone wants to speak. If you want to speak, raise your hand, send it or contact attendee support in the chat and let us know. And I'll give folks a few minutes to respond. Looks like no one has responded. So thanks for attending today's hearing. Just a reminder, you can submit written comments through June 12th, 2020, this year, June 12th. To submit written comments, please visit regulations.gov. The actual link is in the chat. And at this time, thanks for joining us. And the hearing will adjourn. Thank you.